Hi guys, this is Dr. Jasmine. Today it's Thursday, January 20th, and I'm coming at you with another video. This time I'm going to be talking about Paxlovid, which is one of the antiviral pills that recently got an emergency use authorization by the FDA here in the United States. And specifically, Paxlovid has two medications in it. One is called nirmatrelvir and the other one's ritonavir. And nirmatrelvir actually works as a protease inhibitor. You can see that down here. So it blocks the production of viral proteins. And the ritonavir essentially prevents the metabolism of this nirmatrelvir antiviral medication. It should be given as soon as possible and within 5 days of symptom onset, unlike the monoclonal antibody, where you have 10 days that you can still qualify to get it. It can be taken with or without food. It's not recommended in patients with severe kidney disease. And just remember that the ritonavir in this medication can have significant interactions with other medications. So always make sure your provider is checking for that. The study that was used to get to the emergency use authorization for the drug was a randomized double-blind study. It involved 2,246 patients with mild to moderate COVID-19, and they had to have at least one underlying medical condition that put them at risk for having a severe form of the disease. So, for example, diabetes or heart disease, and they were randomly assigned to either Paxlovid or placebo for 5 days. Interestingly, Paxlovid reduced the risk of COVID-19 related hospitalization or death by 88% compared with placebo. And then when they looked at patients through day 28, 0.8% of patients in the Paxlovid arm were hospitalized compared to 6.3% in the placebo arm. And for me, the most significant results were in patients 65 or older, and they found that 1.1% of patients on Paxlovid were hospitalized compared to 16.3% of those on placebo. There were no deaths in the Paxlovid arm, and there were 12 deaths in the placebo arm. And it should be noted that all of these results were statistically significant. So in conclusion, if you are diagnosed with COVID-19 and you have risk factors that put you at risk for having a severe form of the disease, for example, age over 65, or you have other medical conditions such as diabetes, heart disease, high blood pressure, obesity that may put you at risk for having a more severe form of the disease, and you're within 5 days of symptom onset, definitely contact your healthcare provider regarding Paxlovid. They can get you the medication through your local pharmacy, and they can also make sure that the medication is not going to interact with any of your existing medications, and they can also make sure there are no contraindications. So thanks so much for watching, and I'll be back next week with another exciting video. Stay safe and stay healthy.